After 30 years as a chiropractor and seeing so many different conditions, I'll give you a case study. 39-year-old woman came in and she just had so many problems going on, bladder problems. She fell down a flight of stairs when she was 18. Sore for a couple of days, but then nothing after that. But within 6 weeks, she started having symptoms of an irritable bowel syndrome. It got worse. Went to the doctor. They prescribed some medications. Nothing seemed to help. They tried a number of medications. They tried different protocols. Nothing helped. She had 3 exploratory surgeries. They couldn't find anything. They thought it was her ovaries because she started having menstrual problems with these abdominal cramps. They took out her left ovary. They took out her right ovary. They took out her uterus. She had 5 bladder surgeries, a total of 13 surgeries. Now she had no control over urinating. She had to wear Depends. She couldn't feel when she was defecating. There was no feeling. She couldn't have relations with her husband. She was so dry that she couldn't lubricate, and it was painful. She hadn't had an orgasm in 13, 15 years and was orgasmic with her husband before that. Even when she was suffering, still they had relations. Then someone said, "Why don't you go to my chiropractor? He helped me with a number of different things." So she went. All this chiropractor did was a little gentle traction. She's laying on her tummy. He did gentle traction. It's called COX, C-O-X, flexion distraction. And he had her do Kegel exercises, and he did gentle side-lying adjustments on her sacroiliac joints. When you look at the study on this, D is the duration, for the chart, the duration of years of her symptoms. I stood for the initial improvement, how many weeks, and N, when were those symptoms gone, normalized. 25 years of bladder problems gone in 8 weeks. And just this list of unable to feel when she's defecating for 8 years, I don't remember how many years, but a number of years gone in 12 weeks. And the last one on this list, which always stuck with me, deficient precoital lubrication. She couldn't lubricate to have relations with her husband for 13 years. Gone in 6 weeks. Even those cells on the inside lining of the reproductive tract started working better when this guy just did some gentle low back work and had her do Kegel exercises. She fell down a flight of stairs when she was 18. She knocked her back out of balance, but she didn't have back pain. So the title of the article, Mechanically Induced Pelvic Pain and Organic Dysfunction in a Patient Without Low Back Pain. She didn't have any pain, so nobody thought of her back. But the problem was in the function of the back. Those joints weren't moving correctly, which would cause some compensatory inflammation. The inflammation then inhibits the nerve flow to the area, and the tissue is not getting the correct message from the brain as to how it's supposed to function. You have to look for the indicators of imbalances. One easy indicator, lay down on the floor. Roll your legs back and forth and let them relax. And when they're relaxed there, lift your head up. Don't move your legs or your body. Just lift your head up and look at your feet. One foot's turned out more than the other one. You got an imbalance in your low back. Don't know what it is, but the psoas muscle, the iliopsoas muscle, is pulling harder on one side than the other. So there's going to be an imbalance in your low back. That's a gentle little screen that may suggest, I better have an evaluation done of my back. That's an easy one. Next, if you have a partner, you stand with your feet together, your partner stands behind you, and you bend over to touch the floor. Your partner just stabilizes your hips in case so you keep your balance. And your partner just gets down and looks at your back, so you have to lift the shirt up. Look at the back to see, are the muscles on one side of the bones, one side of the spine, higher than on the other side? So you get down low, so you're like looking just above the cheeks at the low back area, and the person is leaning over. So now you lift your head up a little bit, so you're looking a little further up the back and further up the back and further up the back. And you just see, are the muscles on one side higher than another? If they are, your back's out of balance. And it may not be giving you pain, but it certainly can be affecting the whole abdominal and pelvic basin.